Thank you for tuning in to the Global Elite Academy. Do you want to open up your own non medical home health agency? Then go to globaleliteacademy.net. That's globaleliteacademy.net. This is part two, how to open your own home health agency. The next thing that you need to do, we left off at financing. So now the next thing you need to do is market research. You need to you need to conduct a thorough marketing research to understand the demands for your home care business in the area that you're in and identify your markets. Are you going to take disability? Are you going to take children? Are you going to take seniors? Now, if you're saying now, oh, I want to take disabled, why? Do they bring in the most money? Is the most need for them? Are you going to be able to find the right caregivers for them? You need to check all this out because there is a caregiver shortage. So you need to do research. The next thing is you need to check in your state if you do for licensing. Is the license required in your state? And that's what I do every week. I'll give you another city or state and the requirements. But when I give it to you like that every week, it's it's not as detailed. That's why I decided to do this part one and part two, because this is more detailed. I'm only going to be telling you, if your state requires license, and if not, and what is IHSS called in your area. But if you don't want to wait on me to get to your state, then you can always Google it and find out at the Department of Social Service in your area. What are the license? Also, you want to make sure you do a background check for you and all of your employees, because when you go to do your license, they are going to want a background check. Now, a lot of states don't want you to get your background check in advance. They'll tell you when it's time to get it. But just to let you know, you cannot be a felon and open up an agency. So if you're a felon and you want to open up a home health agency, you can't. It cannot be in your name. And you can't, hire caregivers as felons. The other thing, you need insurance to cover your business. I think it's liability. I think it's $2 million. Well, I'm not going to say that because each state might be different. So we'll look up when I get to your state to see how much your state charges for that. But there are certain companies that do give you insurance. And most of the time, when you're applying for your license, they're going to ask you for your insurance. And you'll have to send that in before they give you your license. Then you need your policy and procedure manual to run your company. You need to have policies about how to hire staff, emergency protocols, and other operational policies and procedures. Now, you can buy, so you could buy a policy and procedure manual. They usually sell them on the internet. The good ones are $2,000. Don't even think about buying the one for $200 or $300. It's only a couple of them like that, but they're not good. And when you do the policy and procedure manuals and you get your license, if they're not up to par, you'll be denied for your license. So you want to make sure it's a quality policy and procedure manual, and they run about $2,000. You can always make up one yourself. That's going to take a long time. And if you don't be in nursing, you wouldn't even have a clue where to start. So you're going to need to purchase a policy and procedure manual. Now, about the office space. Again, You can have it in your office. I'm sorry, in your home. And then if you want to interview people, like some people will go to a restaurant and interview. You can go to the library and get one of those private rooms and interview. You can, they have they have those office where you could go to the office and rent an office space for an hour or 2 hours or 3 hours. You could go there and rent an office space from 9 to 2, and then just set up all your interviews back to back. You could do that. And what a lot of companies are doing now, they also are interviewing on Zoom. A lot of people will interview on Zoom, but you have to make sure you can see a full presence of the person's face and everything. And then when you get ready to do your orientation, you will all be in the same room. You can rent the office or whatever and have everybody come down to do an orientation. But anyway, that's how you can interview. Because a lot of people, I don't know, these people are so lazy nowadays. They don't even like to go for interviews. I've been hearing that people set up appointments for the people to come in for an interview and they won't even show up. It's better, but some of them will show up online. So you can, you just have to try whatever works. The other things, you have to recruit caregivers and give them training. It is mandatory that the caregivers have training at least once a year in different areas. It could be Alzheimer's. It could be how to do, how to feed a patient. It could be dealing with dementia patients, dealing with Alzheimer's patients, Parkinson patients. They just need to be you need to offer continuing education for your caregivers. Okay. When the caregivers clock, they have to clock in and out. So you have to get the software for them to clock in and out. Usually when they clock in and out at the patient's house, that's when they're going to do their charting. Usually when they clock in, they'll clock in for a patient, under a patient name, they'll clock in. And then when they get ready to clock out, the system won't let them clock out until they do the charting. So if the patient's hair was supposed to be combed, they have to check that. The patient was supposed to get a bath, you have to check that. All of that. Now, they do this on their phone. And when they mark off everything the patient, that they did for the patient, then the system allows them to clock out and they're able to clock out. So you would definitely need that clock in, clock out system. Now, what about marketing and growth? This is where, you can't have patients if you don't market. So what I was telling you, like we had somebody who will get you on the first page of Google. Now, if you're going to get your own marketing person, you need to make sure that they could get you on the first page of Google and you have the money to do that. Because if you're not on the first page of Google trying to do home care, you're going to have a hard time getting, growing your agency. So you want to make sure you're on that you're dealing with somebody. And the thing about marketing is these people will tell you, oh, I could get you on the first page of Google, and they don't get you up there. You'll be working with them for a year, 2 years. You still ain't on the first page. So we have a proven, a company we work with, it's a proven. Everybody I refer them to, they have gotten on the first page of Google. And they've got them on there in a matter of a few months. I think sometimes they have different marketing strategies. But I know one person, they couldn't do her because everybody is different. They couldn't get her company up there in 2 or 3 months. It took I think it took a year and a half. But they did get her up there on the first page of Google. Now, she's the only client that I ever referred to them that it took that long. And there was specific reasons for that. And you can always ask the people, why did it take so long to get her up there? But the other people that I referred, the other agencies, In a matter of 2.5 months, they were getting calls and from the ads that were going up. So you need a marketing strategy. You want to ask the people, the marketing people, IT people, what can they do to help you grow your agency, and then they'll give you different marketing strategies that'll work for your company, and then get the one to fit your budget. You definitely want to have an online presence, so you need to have a web page, things like that, because you want to have a presence. You definitely want to do networking. We have a software company where doctors are there. I told you about this in the other part one, where doctors, hospitals, rehab centers, they're all in this network where you can market to them within the network, and they will refer patients to you. Um, where you can, like, it's a community organization meant to build referrals and partnerships. So we tell you what company or what software to use. We you know what I mean. You don't have to go look for your own software, because we've did the work to do that for you. Now, when you open up a home health agency, you are going to, how are you going to, what is it, how are you going to, what type of patients are those? Okay, so you're going to be able to take private pay and long-term insurance. That is the only thing that you're going to be able to take, okay? So these patients, if they're not rich and can afford your service, then that means, you're not going to be able to get them. So it's going to be, like I said, patients that can afford your service. Now in Arizona, in Arizona, the service is running between $28 and $36 an hour. And Colorado is running between $30 to $40 an hour. So you need people who got money that can do that. If they're low income, then you have to get the IHSS license so that you will be able to get those kind of patients. If you don't have the license, the IHSS license, you cannot take low income patients. You can only take regular patients, which is high income, and long-term care insurance. The long-term care insurance, it depends on, they have different rules. So it depends on which company, what insurance company it is. Because I've worked with them, and sometimes they'll only pay off on CNAs, which are certified nurse assistant. So if the caregivers, for the patients, if the caregivers are just homemakers, they won't pay. So you have to, not you, but the family have to check and make sure the insurance that they have qualifies them to pay, a PCP, which is a personal care provider. If it's just a CNA, a certified nurse assistant, that means that's the only type of caregiver you could put on that case is a CNA. So when somebody has a long-term care insurance, you need to ask these questions and go through it. And then sometimes they don't take non-medical agencies. They only take skilled agencies. So you have to make sure that policy will pay your company. Okay? So that's how you open up a non-medical home health agency. If you have any problems, go to globaleliteacademy.net, look up the phone number, and give me a call. Thank you so much for tuning in to Global Elite Academy.